Chinese medicine treatment for PCOS. But today we only focus on Western medicine treatment for PCOS. Okay, we're not about today not about Chinese medicine and acupuncture. But tomorrow, yes, we talk about acupuncture treatment and Chinese medicine treatment for PCOS. You know, okay, so hopefully that makes sense to you. We're gonna get a little bit done every day. So if you're up in this live video, please give me a thumbs up and say hello to me. Something like that. Okay. Hello Eric, how are you? Great. That's good. And I'm going to my Facebook and do some share. Hoping that you can do the same with me. So on the Facebook, and you can create a watch live. I can do share. I can do watch party. Okay, we'll do a watch party later. Okay, let's see. We'll start a watch party. Yeah. Okay, what we do. Alright. Hello, happy day. Thank you for being here. Okay. Now today our topic is Western medicine for PCOS. Okay. Right, let's start. Okay. If you're up here, please give me a thumbs up and say hello to me. Thank you very much. Good morning, Rika. Nice to see you too. Alright. We talked about the diet yesterday and changing diet and plant-based diet and exercise, changing lifestyle to treat PCOS. Okay, and that's must. When it comes to Western medicine, treatments, you may still go there, right? You still want to change your diet, okay? But unfortunately, if you suffer from PCOS, okay, and if you're using the drugs that your doctor provides you, it actually put on weight. So it's funny, isn't it? We actually tell our patient to lose weight because we mentioned that if you lose about 5 to 8%, or 5 to 10%, which if you let's say if you are 80 kg and you only need to lose about 4 to 8 kg, then to regular your period. Losing weight can regular your period, right? But unfortunately things is if you put on the pill, birth control pill, and that is the most common treatment for PCOS. If you are not trying to have a baby, you know, fertility treatment for. If you suffer from PCOS and you want to get your regular menstruations, and yeah, the doctor just put you on pill. That is the best treatment and the most common treatment. Okay. And the side effect is you gain weight. So you are relying on the pill to give you it's a fake hormone in your body to make you regular in your menstruation. Then what happens if you stop the pill? Bang, irregular period again. So this is not a proper way to call it as a treatment. Okay. And we know the pill, the birth control pill, give you side effect of gain weight and joint pain. Joint pain as well. Okay. So that is an acne. You know, those are the symptoms that you don't want. Now, the hormone pill is, well, there are a few ways that they give you the hormone. It's one by taking, one by patches, put a pad on the body, they give you that, or you got a vagina ring, then instead of a vagina ring for you, and to try to regulate your period, right? Then the next thing, the birth control idea is actually, we know you have high male hormone and low female hormone. It just, what is balance? Balance is, this is balance, this is imbalance, and this is imbalance, right? When we say this imbalance, means out of balance, means something is too much and the other is too low. That's called imbalance, you know, or too much, too low. What does it mean? It means that in this case, PCOS, and male hormone too much, female hormone too low. So you need to regulate this. Okay. And it does help with birth control. It does help with regular period. That's not a long-term solution. Unfortunately, it's not a long-term solution. Okay. And I don't agree with it personally, to be honest. Okay, I have a friend, a master too, in America, Kirsten. She got a book, and she actually teach you how to get rid of the pill, birth control pill. It's a recent book, I think, pretty recent. Oh, it's last year, started last year. Okay. The other common drugs for PCOS is metformin. So then you want to ask, why metformin? And that's because PCOS, 80% of the patient have suffered from insulin resistance. Because of the insulin resistance, you know, it look like type 2 diabetes. That is why they use metformin for you. That's why they use metformin for you. And again, I don't agree with metformin, right? But although I don't agree with it, it doesn't mean that I can't talk about it, right? I want to tell you this is, I don't agree with it, but this is what it is. Your patient, when you see your patient, they may have all this drug. Okay, they may have all this drug, so you need to understand it. Right. Metformin. If you're taking metformin, I would actually suggest you do your exercise, change your diet, throw away metformin. But that is not my call. It's you and your practitioner, which is your Western doctor, to make the call for you. You need to discuss about the side effect of metformin. Well, the side effect of metformin, it actually may cause you blurry eyes. Then it's liver, causing liver issue according to Chinese medicines, TCM. and dizziness, headache. What else? Heartburn, bloating, stomach pain. You see, all these unnecessary side effects that is causing metformin, and you may get diarrhea or constipation. All side effects for metformin. So this is important to know of. If your patient are taking metformin, you want to check whether they have side effects or not. Okay? That's very, very common. Now, if your patient comes from infertility and the reason is because PCOS, and that is a drug that actually help them to ovulate. It's called clomiphene. Or clomid, or you may hear about clomid, is a fertility drug that can help women with PCOS get pregnant. Yes and no. There's side effects. What is the side effects? If you want to have a lot of baby, yep, it increases the risk of twins and other multiple births. Okay, that's what clomid. Okay, of course I want to tell you here and here with we talk about the female the male sperm once ejaculate. After ejaculations, the sperm can live up to 5 days, right? What does it depend on? It depends on cervical mucus. The cervical mucus can create a nice and right environment for, this is one of the factors for sperm to live. The funny thing is clomiphene actually help you release eggs. It does work, but it actually decrease your body to produce cervical mucus. Now we have asked patients. Some patients say, well, yeah, it dry up. Some patients has no effect. They don't get the side effect, and which is good. Okay, so I want to mention to you clomiphene. In that way, it helps you to produce egg, ovulation, put you into ovulation, but it may, quite often, dry up the mucus. So, which means you have no, it's not good for sperm to survive in the body. Now, another treatment is surgery. What surgery means is the cyst is in the ovaries, right? You have multiple cysts, and if some of them is too big and they're causing enlarge of the ovary, then the ovaries, when it is big, it actually causes some pain. I want to tell you in general, if you suffer from PCOS, but you have a lot of cysts in your ovaries, you don't generally get pain. right? You don't generally get pain. But if one or two of the cysts, it become big, I mean very big, right? It actually causes pain because pressure, because a lot of pressure, so it actually causes pain. Okay, now also when you let you know this is when it causes pain, and acupuncture and Chinese herbs are very good for it. But when it's enlarged in this case, then Western doctor will choose to, it may suggest you know, or you may choose this kind of treatment, which is surgery. So with this kind of surgery, it is actually ovarian drilling. Like it is a process that makes a tiny holes in your ovary with a laser or thin heater needles to poke it to restore the normal ovulation. Okay, I had a patient recently. I'm still treating her. She removed the because she suffered from endometriosis. So remove the uterus and remove one side, which is the left side of ovaries, and the right side ovary is still there. But unfortunately, the right side has got PCO, like polycystic ovaries, and one of them is enlarged, it's quite big, and causing that a lot of pressure on the left ovaries areas, abdomen. And the reason she keep that ovaries is she want the ovaries still keep working and produce hormone, female hormone for her to help her keep going. That's why she didn't remove it. That was the key. But that one actually causing a lot of problems at the moment, like causing them pain all the time, 24 hours. Okay. Now, that's it. So we know. And how did she know that? And she actually is a practitioner of ultrasound, and her colleague actually did it for her, and she can see that on the ultrasound, and she can see that how big it's at. You know, it's enlarged and causing a lot of pain. Okay. Alright. Stay awesome, and I love you all, and I'll see you tomorrow. We're going to talk about Chinese medicine, acupuncture treatment for PCOS. Right? Dun, dun, dun. Thank you. See you tomorrow.